This is Where We Live on Connecticut Public. I'm Lucy Nalpathanchel. Deaths from opioid overdoses continue to be a concern. Here in Connecticut, more than 8 out of 10 overdose deaths in 2021 were caused by fentanyl. That's according to the State Department of Public Health. Nationally, the CDC says most cases of fentanyl-related harm, overdose, and death in the U.S. are linked to illegally made fentanyl, often mixed with other drugs, to increase its euphoric effects. Meanwhile, fentanyl has been brought up by politicians in the lead-up to the midterm elections, debating how it's coming into the country. Today, Where We Live, we're focusing on what's being done in our state to help individuals and families impacted, from treatment options to prevention efforts. Now, has someone you love been impacted by fentanyl? You can join us too. 888-720-9677. That's 888-720-WNPR, or find us on Facebook and Twitter at Where We Live. My first guest has a personal story to share with us. Dita Bhargava is a Connecticut resident whose son died of a fentanyl overdose in 2018. She's also a Shatterproof ambassador. Shatterproof is based in Norwalk and is a national nonprofit dedicated to reversing the addiction crisis in the United States. Dita, welcome to our show.
Hi, Lucy. Thank you for having me.
First off, we're so sorry to hear about the loss of your son. I understand his name was Alec. Can you tell us about him?
Yeah, Lucy. Alec was a young, vivacious, filled with life, jovial, humorous, highly intelligent and sensitive young man, young man, and then full-grown adult. And as a teen, Alec suffered from a mild bipolar condition and started self-medicating, first with easily available. Well, first, actually, he started experimenting with marijuana, and then with easily available opioids, and then eventually with heroin. And in the end, Lucy, Alec wanted nothing more than to live a life of recovery, empowered by the love of his family and friends. But unfortunately, on his 26th birthday, while he was living in a sober home in Canaan, Connecticut, he unwittingly died of fentanyl poisoning. And what's so tragic is that in the end, Alec wanted nothing more than to live a life of sobriety. And he just was not given that chance. He often talked about two voices in his head, one that would say, this is the last time I'll ever use, and just that one last time, and another one that would tell him, don't do this. You've been doing great, and let's stay on the road to recovery. But it's an insidious disease, addiction disease, and from everything we gather, it was his birthday. He wanted one last celebration, and that was the last time he was ever allowed to celebrate at all.
Mm-hmm. Again, I'm sorry to hear his story and the impact on you and your family, Dita. Can you talk a little bit more about the challenges as Alec was on the path to recovery and what you experienced as a family? Yeah.
So during Alec's 7-year struggle with addiction, my husband and I desperately searched for the proper treatment for him. And Alec would spend months at a time at different treatment centers focused on his recovery. But often and sadly, there was little to no transition plan offered to him at every release from those treatment centers. And so without the necessary support, this disease of addiction was overwhelmingly difficult to manage for him, to manage for our family. And the frustrating experience with navigating treatment centers, that's what prompted me to do some of the work that I do through Shatterproof, because I know so many families are just at a loss, as we were. It was a gut-wrenching thing to watch our son desperately wanting to release himself from this disease and live a normal life. And we were at our wits' end as to how to provide that care. And society is not, unfortunately, set up for people in recovery to get the support that they need, to get the help that they need. Often, Lucy, we would have to battle with insurance companies and while we were trying to get approval from insurance, it's a very small timeline that you have when someone who's suffering from addiction disease is willing to go into treatment because their body just wants the drug so desperately and they're in pain. And so to have to wait for approval from insurance, that time could actually cost this person's life because they may just turn to the drugs. And now with the scourge of fentanyl, like you said, 80% of people who overdosed last year in Connecticut was fentanyl related. You just don't have that. You can't take the risk, and you don't have the time. So it was a very, very difficult time for all of us. And my biggest fear for so many years, because I was seeing the impact of fentanyl, the scourge of fentanyl in our cities and towns and states across the country. And I knew we were up against this timeline of, when we could get him into the permanent path to recovery and when the fentanyl would ultimately take his life.
Dita, I feel like we've been, as a country, talking about opioid overdose deaths for some time, and there have been a focus on what you're saying related to what families and individuals go to when they try to connect to treatment, the barriers to getting insurance to pay, or even finding a place that has enough beds. What are some of the barriers today that still exist, and why do you think that is?
Look, I think those barriers still exist. Finding the right place for treatment, even having enough beds. And I think those barriers continue to exist, Lucy, because of the stigma of addiction disease, because it is something in the brain. It's not like a leg that's missing. It's not, with cancer patients where often you can see that they either have loss of hair, they look sick. It's in the brain, and so because it's not visible, and because of the lack of education to our communities, that people think that it's a choice. It's not a choice. It's very much a disease of the brain and a chemical imbalance. And I think those barriers are why this country is not up in arms talking about this all the time. 100,000 people died in our country last year, and they will continue to die. And if you add in, the mental health portion, because the mental health disease and addiction disease go hand in hand. If you add in suicide, if you add in alcoholism, you're talking about hundreds of thousands of people who are dying every year. Life expectancy has fallen, I think, for the 5th year in a row, largely because of addiction and mental health disease. This is a long-term societal problem, and we have to speak about it in our communities, at the state level, at the national level, and make this the priority that it is.
Again, you can join us, 888-720-9677, as we talk about the opioid overdose crisis, specifically fentanyl, as we focus on that for today's show. You're hearing with me on Zoom Dita Bhargava, a Connecticut resident whose son died of a fentanyl overdose in 2018. Coming up, we're going to hear more about her work with Shatterproof. She's an ambassador for this national nonprofit based in Norwalk, dedicated to reversing the addiction crisis in the U.S. But first, I wanted to take a call from a listener. Ron's calling in from Lebanon. Ron, we have a couple of minutes. What did you want to share with us?
Yes, my stepson died in 2016, and fentanyl overdose, utterly horrible. We had a meeting with the police at Norwich, and I spoke to him, and I told him I'm an ex-drug addict myself. I told him I could walk out of this building and find fentanyl in 15, 20 minutes. And he assured me that they were building cases. It's there. The drugs are everywhere. It's literally an epidemic. The stuff is so poisonous, and it's killing our kids left and right. And the police, my opinion, they're not doing their job. How is it that I could walk on the street cold and find this stuff? It's their job. Their job to make arrests and clean this place up, and they're not doing anything. my opinion.
Yeah. Well, Ron, thank you for calling in, and we're sorry to hear about your stepson's passing. Again, you can join us 888-720-9677 or find us on Facebook and Twitter at Where We Live. Dita, I'm wondering if you could respond to what Ron shared, because there's an emphasis on treatment and support for families, but there's also there are questions about why this drug is so prevalent, and should there be more enforcement? Why isn't there more enforcement, according to Ron? What's your take?
Yeah, Ron, I'm very sorry for your loss, and similar to your loss, my son also. Our son died in living in a sober home in Canaan, Connecticut. First of all, he should have never been in that sober home. It was meant for people who were sober for over a year, and he was just 3 months sober. But again, that was the lack of the transition that he had from the treatment center he was at. And he found his way to, we believe, to find heroin in Hartford. Heroin was laced with fentanyl. He had Narcan sitting by his bedside in the sober home in his bedroom, where there were kids right outside of his room. They had no idea that he was using, and he had Narcan sitting next to him just in case. But of course, nobody knew that he had overdose, so no one had to administer the Narcan. The scourge of fentanyl is literally killing our youth across our country. It's a complicated problem that we have. Many people who end up selling are people who suffer from addiction disease themselves. But we do need better enforcement. Again, it's complicated because the police are also bound by the laws that are set by the state and by the country. I know there are organizations out there who are advocating for stricter laws, and penalties for drug dealers who knowingly traffic substances laced with fentanyl, with an admonishment clause for the first offenders, for example. But if they do it again, that they should have severe penalties. I'm in total support and agreement for that. But the other side of this equation, Lucy, is that we need to get to the root of the problem, which is the demand. And now there are a lot of users, people who suffer from addiction disease, who seek out fentanyl knowing the potential dangers because they are addicted, because nothing else will pacify their pain than highly potent fentanyl that could actually kill them. So the demand is the problem, and that's where we need severe improvement in harm reduction, in helping people manage their addiction disease through medically assisted treatment. I've advocated for safe injection facilities. If you look at a country like Portugal, where all of harm reduction has taken away their heroin crisis, they had a heroin crisis, which was horrible, and they reduced it by 90% in 7 years, purely by harm reduction facilities and programs. And that's where we can fight the fentanyl most effectively and impactfully, is by reducing and erasing that demand, by having people on medically assisted treatment and having them in safe injection facilities where we can save their life and have the opportunity to educate them. And I really think we need to think about this.
And Dita, I know you've testified in support of safe injection sites. When we think about what those barriers are to that idea here in our state, and how much stigma affects that.
So again, I think stigma, unfortunately, the definition of stigma is a mark of disgrace associated with a particular circumstance, quality, or person. So, disgracing our people who are suffering from a disease is just, it's a barrier, that needs to be erased, because this is pervasive. We 1,400 people died, I believe, last year, and that number is going to continue to go up, over 100,000 in our country. This has long-term effects. Our son was a hardworking, smart, intelligent man who gave tremendous impact to society. He helped his friends. He was going to be a wage earner. He would have had a family of his own. These people are dying. So what does that to us long term? Has big impact. So we need to erase the stigma and get to the root of this disease and help save lives. And the way to do that is to accept us as a disease and have these programs that may seem like they are outrageous, but they're not. They're saving lives. And we see this, proof of this in cities and countries outside of the United States that have proven data to show that it saves lives and it allows those people to be educated and help them steer away from seeking out those drugs that will kill them on the spot, like fentanyl.
I wanted to bring in another perspective. With us on Zoom is Dr. Catherine Hawk, Associate Professor of Emergency Medicine at the Yale School of Public Health and also the program in Addiction Medicine. Kate, welcome to our show.
It's good to be here.
I wanted you to respond to Dita's story, as well as, a few times now we've heard about addiction as a disease. And I'm wondering if you can explain that more for our listeners when we think about the treatment options and the path to recovery, some of the big challenges.
Sure. So, to start with, Dita, I'm so grateful for you sharing your story and your perspectives. I think that you've highlighted a lot of really important things that we know about, how to treat addiction and opioid use disorder, specifically around the support for overdose prevention sites, the availability of harm reduction, and how important it is to really grab and capture that moment and opportunity if you have someone who is, willing to initiate treatment. Because you're right, they can be fleeting. And so that is one of the things that I think, the medical system doesn't necessarily do a great job of, or as good a job as they could. And so I think that has been a lot of, the source of a lot of our work in the emergency department to try to make, this to really reinforce this concept is no wrong door to go through to get help. And by help, I mean a couple of different things. So one, you mentioned access to sort of harm reduction, certainly discussions around naloxone and syringe service programs, but also, certainly, access to medications that we know work very, very well to help reduce opioid and non-opioid associated mortality, viral transmission, and that's specifically methadone and buprenorphine. And the way that those medicines work, there's a lot of stigma around them. But really the way that they work is by helping to address, this change that we see in the brain that you sort of asked about, Lucy, because it's, there are fundamental changes in the way the reward system works, in the brain with repeated exposure. And what these medicines do is they allow someone to manage their craving and their withdrawal, in a controlled environment. And by that, I mean, they're getting medicines from a pharmacy or from an opioid treatment program or from a medical provider. And it allows them to manage their withdrawal symptoms. It allows them to manage their craving and allows them to sort of do the work to help improve sort of the other areas of their life to help move forward.
When we talk about medication-assisted treatment, what are some of the challenges when someone is in recovery, when you take this particular medication to help them, the side effects? And is there a struggle for some people that because of the side effects, that they have trouble continuing with MAT?
So I'll be honest, I think the biggest, the unequivocal largest barrier to medications for addiction treatment is stigma. I think that there's a lot of, internalized stigma and a lot of shame around having an addiction. I think there's a lot of misunderstanding that these medicines can be helpful, and what they do for an individual. It is very much not, exchanging one thing for another is one of the criticisms that you hear. And the reason it's not is because the whole method of how you engage with this medication, how you take the medicine, how it controls your day-to-day living is very, very different. And that's actually the crux of, why, what addiction is and how it can be so disruptive to your life. Otherwise they are, there can be side effects associated with the medications, but in general, they're far less than sort of the effects that we see from ongoing drug use. We do know from a barrier standpoint, there are a lot of sort of policies and regulations, both on a state and federal level, that really, really restrict access, individual access to these medications. And I think that, in 2022, when we are seeing such an incredible number of opioid-associated deaths, that it's really important to really think about how we can do things like, make it easier for people to get, their X waiver, or to eliminate the X waiver altogether. Don't allow, physicians to say, I'm not licensed to do that because I don't practice that kind of medicine. When you have this degree of insidious disease, across the country, this is, I think the idea that it can only be, it's only done in specialized places, or people can say, I'm not able to do that, or I choose not to do that. I think we really need to rethink our approaches around, who can at least help initiate treatment and link people to treatment, and really make it a priority across all, general healthcare settings.
Isn't there also pushback from communities, Kate, who don't want medication-assisted treatment centers in their neighborhood? I believe there's a community in New Haven that's also opposing a potential MAT center.
Yeah, I mean, I think stigma is something that we certainly see a lot of, and some of it is, a lack of sort of education or awareness around, what these centers or treatments offer. Some of it is around sort of how communities are involved as these programs are grown and developed. I think that, it is important to sort of integrate and to think about how, what services are needed in what communities and how it might impact the community, but overall, I think the fundamental, challenge is that there is a lot of stigma against people who use drugs. And I think that is in part, directly related to the increase in deaths that we see from fentanyl.
We're going to take a quick break. My guests today are Dr. Catherine Hawk, Associate Professor of Emergency Medicine at the Yale School of Public Health and the Program in Addiction Medicine. Also with us is Dita Bhargava, a Connecticut resident whose son died of a fentanyl overdose. She's an ambassador with the national nonprofit Shatterproof. They'll be joining us again in the second part of our show, and you can join us too with your questions. 888-720-9677, or find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public. I'm Lucy Nalpathanchel. Today we're talking about opioid overdose deaths, specifically caused by fentanyl that's mixed with other drugs. My guests on Zoom, Dita Bhargava, who's a Shatterproof ambassador. This is a nonprofit working to address the addiction crisis in our country. Her son, Alec, died of a fentanyl overdose in 2018. Also with us, Dr. Catherine Hawk, Associate Professor of Emergency Medicine at the Yale School of Public Health and the Program in Addiction Medicine. Catherine, or Kate, rather, senior producer Sujatha Srinivasan spoke with the Department of Health Commissioner, Dr. Manisha Jutani, on the availability of fentanyl-laced products and what the state is doing about it. Let's hear a little bit of that conversation.
The lacing of fentanyl of many of the other products that are being used in the market is extremely scary because we know the potency of fentanyl. We know the ability for overdoses to occur. We know that both fentanyl and xylazine are very, very potent drugs that often may be lacing other products. And if we see a particular spike in an area, we send out alerts. We let local areas know about this so that they can be on alert to respond to any specific overdose and potential increase in calls that are coming from a specific area.
So again, Kate, she mentioned xylazine and fentanyl. When we look at data from the Connecticut Chief Medical Examiner's Office, there were 221 deaths up to August of this year with that drug combination. In 2020, the number was 141 deaths for the full year. So can you break it down for us further when we hear xylazine? What is it, and the problem that you and your colleagues are seeing in the ER related to fentanyl-laced products?
Sure. So xylazine is a sedative tranquilizer that is used in veterinary practice. It is not FDA approved. It's not a medication that's intended for sort of human use or consumption. And then we have certainly seen a huge increase in it, as you mentioned, in the Connecticut opioid overdose fatalities. I think starting in 2019, xylazine might have been present in about 5% of them. In 2020, it was about 10%. And just this past year, it was actually up to 20% of opioid-associated fatalities in our state. And so we know that it is very, very prevalent in the Connecticut drug supply. And it is, something that, can be intentionally sought out or inadvertently exposed. It's really difficult sometimes to identify, how, which individuals are, selectively trying to, target, which specific substances. But the thing that we do know about xylazine is that it can make, certainly the wounds that we see with xylazine from associated with injecting or, worse than we have traditionally seen with heroin or fentanyl. We know that sort of these complications around, sort of skin and soft tissue infections and abscesses, that is something that is worse with xylazine. I think the thing that is probably, if you look at the overdose death rate in Connecticut, I think it so clearly highlights that, this is, the idea of trying to regulate and control the drug supply is, this is not working. I think that it's, it has gotten just more and more dangerous. And, it just highlights how important it is to really focus on, offering treatment, offering low barrier treatment, offering harm reduction, pulling people into services, whether it's their harm reduction oriented or healthcare services, so you can at least form those relationships. If people are not yet ready to stop using drugs, you can form those relationships and at least get them sort of the healthcare. You can start talking about sort of reducing harm, minimizing infections, and things like that.
And Kate, when you talk about how this is particularly dangerous, this combination, xylazine and fentanyl. When we hear about opioid overdoses, so much emphasis on having the availability of Narcan or naloxone. But with this combination, does Narcan even work?
So it's interesting. So it can, it really depends on the degree, which substance is it that's really driving the respiratory depression. And so, certainly would encourage everyone to access naloxone, to have naloxone sort of available. If you see someone who, is, showing signs of an opioid overdose, either, decreased respirations or small pupils or not responding, have a very low threshold to use, administer naloxone and call 911. There are certainly cases where if you have this mixed ingestion that naloxone, will, knock the opioid off of the mu receptor, to a significant enough degree to sort of wake the individual up. But if there's a lot more xylazine, that may not be the case. And so, that's why it's really important to, not just administer naloxone, but also call 911. And if you are EMS or in the healthcare facility to make sure that you, administer oxygen and sort of support the breathing in it as much as you're able to.
Dita Bhargava is still with us again. She's a Connecticut resident with a personal story with her son who passed away from a fentanyl overdose. She's also an ambassador to Shatterproof, which is a national nonprofit based in Norwalk that is working to address this addiction crisis in our country. Dita, when we hear about Narcan, is it as available as it needs to be? What are some barriers that you or others are seeing in our state?
Thanks for the question, Lucy. I don't think that there could be enough, given the numbers in how many people are dying in our state and how many people overdose. It can't be enough. Now I really do think, I know you will be speaking with Bianca later, but having Narcan in the schools as part of an education is extremely important. I'm sure you know, Kate, that young teenagers are now dying, pills that look like candy that are laced. We need the education in schools. We need to warn kids. And part of that education also has to be resiliency building, social emotional learning programs, which I've advocated for years, that we have mandate K-12 social emotional life skills programs so that we can arm kids with resiliency so that they don't turn to substances to fill, whatever emotional gap they may be feeling like our son did. So I think that combined with every school should have an abundance, and every community center, boys and girls clubs, that they have an abundance of availability of Narcan, and that people are trained. And that was part of what I did. Alec is my guiding light in my journey to help others through creating awareness around mental health and addiction disease. And really that he gave me sort of the rallying cry. A few weeks before he died, I was actually running for statewide office, and I asked Alec how he would like me to talk about his journey, his illness. And Alec answered my question with his own question, which was, would you be asking me this question if I had cancer? He said, yeah, I have a disease. My friends have died of this disease and more will die. And yet there seems to be a reluctance to help or even talk about this disease because of the stigma. So please go out there and talk about it and do what you can. And so that's when I started to organize, as an ambassador to Shout Proof. I went on a tour around Connecticut to create awareness, inviting federal and state legislators, healthcare workers, paramedics, law enforcement, the public, and to educate. And a lot of that was training for Narcan use. And so I think there can't be enough, Kate. This is only a growing epidemic. It's a pandemic, actually. And we have to throw everything we can at it. Education is a huge part of this.
Again, you can join us 888-720-9677 or find us on Facebook and Twitter at Where We Live. Catherine Hawk, Kate, you're still with us, and I wanted to circle back to Alec's story. Dita mentioning that he was diagnosed with bipolar disorder. Data show that bipolar disorder is most likely to co-occur with alcohol or drug misuse. Also, research shows bipolar patients who misuse substances can have an earlier onset of illness. Can you explain that for us?
Sure. So I think, the way that I think about how many people come to drug use is that it is a form of self-medication. And so I think that, for people, who have, anxiety, often alcohol or things that sort of depress the system, might be at play. For people who, have, it is, often it is a way to sort of try to internally regulate, the feelings and experiences that people are having. And I think a lot of times that's what drug and alcohol use, sort of how people wind up using drugs and alcohol. As far as sort of co-occurring, mental health, we certainly know that it's a problem. We certainly know that, depression can exacerbate, drug and alcohol use and vice versa. And we certainly know that, for example, if you step back and sort of look at what happened around substance use during the COVID pandemic, there was certainly, tremendously increased, anxiety and uncertainty among, the vast majority, of the population. There was a lot of social isolation and depression, and so I think the way that people interacted with drugs and alcohol changed a lot, meaning, there was a lot more increase in use. There were people who, may have been sort of successfully managing their substance use before, who had a return to use or increased use. And so, I think those things are really quite intertwined. When you think about opioid use disorder specifically, though, I mean, that the data are just very, very clear that medicines, is a step in the pathway and a tool in the toolbox to help keeping people alive. And so, whether or not, there is co-occurring depression or bipolar or anything along those lines, access to, buprenorphine or methadone, we know sort of unequivocally improves patient outcomes.
And Kate, I want to reset that you're an associate professor of emergency medicine at the Yale School of Public Health. So when we talk about ERs, especially at Yale, the shortage of ER beds, how that affects care for people who are dealing with substance use disorder, and what is Yale doing about it?
Yeah, so it's this year has been a particularly challenging year, from an emergency department standpoint. I mean, boarding is absolutely through the roof, and when you talk about trying to make it a good experience for people to access ED care, it is a challenge, not just in our ED or in our state, but really around the country. What I will say is, Gail D'Onofrio, who was our chair for many years of our department, published a study in 2015 where she looked at 30-day treatment engagement for individuals who had untreated opioid use disorder who were in the emergency department, and those that were randomized to receive medication and a follow-up appointment were more than twice as likely to be engaged in treatment at 30 days than those who just left with a referral for outpatient treatment. And so that, that's 78%. Of people were engaged at 30 days if they actually started on medicine in the emergency department. And so that has really, really shaped a lot of the implementation work we've done in our emergency department and in emergency departments around the country around, really reinforcing with clinicians who are burned out, who are, having a really, it is the ED can be a challenging place to work and a challenging place to be a patient. But, really doing a lot of work with ED clinicians around, who previously thought that they were not able to help people who came in opioid withdrawal or didn't know how to, provide treatment. And, the thing that we are really emphasizing is, sort of acknowledge, the stigma, acknowledge that, these are people who have by and large had traumatic experiences in the ED before, offer naloxone and offer treatment. And if you do those four things, by and large, we know that people do better.
We're going to have to leave it there with Dr. Catherine Honk, again, Associate Professor of Emergency Medicine at the Yale School of Public Health and the Program in Addiction Medicine. Thank you for your time on the show today.
Thanks for having me.
You're listening to Where We Live on Connecticut Public. Adita Bhargava is with us, an ambassador with the national nonprofit Shatterproof. Dita, if you can, we'd love for you to stick around for this next segment. After the break, we're going to learn about a partnership to help schools statewide gather and share resources about substance misuse among young people. You can join us too, 888-720-9677, or find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public. I'm Lucy Nalpathanchel. The BBC reports that teen overdose deaths have never been higher in the U.S. More than 100,000 Americans died of drug overdoses last year. They were mostly adults, but the fastest growing group to die of overdoses were teenagers. It was January of this year when a 13-year-old Hartford student overdosed in school after taking fentanyl. What are schools doing to help prevent substance use among youth and connect students with supports? This year's CERC, the State Education Resource Center, has created a new initiative in partnership with the Connecticut Department of Mental Health and Addiction Services. With us to explain on Zoom with us, Bianca Irizarry, a consultant with the State Education Resource Center, CERC, and coordinator of this new school-based Center for Prevention, Education, and Advocacy. Bianca, welcome to the show.
Thank you so much for having me. It's a wonderful opportunity, and I'm happy to be here to talk about the center.
So the center is launching. What was the impetus?
So we have actually been collaborating with TMIS for the past 4 years on work around strengthening substance misuse prevention in schools. And so from that work, we saw the need for the center and to have a centralized space for anything school-based prevention related, and one spot where schools and families in the community that is part of that schools to go to access information around school-based prevention. So we are in the process of developing the center to do just that.
So when you think about the gaps, we heard from a caller earlier that says, when we're talking specifically about fentanyl, it's everywhere. And we know that young people will experiment. And so when we think about gaps and how to continue to push this mention of this importance of prevention, Bianca, how will the center accomplish that?
Sure. So thank you for mentioning that, because that's really what the center is promoting. We're promoting prevention. There's definitely a need for intervention and treatment, but we're promoting prevention, specifically strengthening schools' prevention efforts. And so we can do that in a variety of ways. We have a comprehensive social emotional learning library collection that we've been working on and curating for the past 4 years that has programs and curricula and what makes it special is authored by psychologists and social workers. It's organized by developmental stage, risk and protective factors, setting where you can implement it. And so we've been in the process of collecting all of these programs and curricula, and they're available online, and you can also take them out of our library as a way to bring that information into districts so that they have access to it all in one space. And so that is a big part of the center, and also bringing what the community agencies have already been doing in prevention, but bringing it into the school setting, which I think is a gap and can be strengthened. And CERC's ability to do that is strong. We have connections to schools. We've been working with schools for the past 53 years. And so those relationships allow us to have that entry point to bring the resources that we've been developing and curating into the schools to build their prevention knowledge and efforts.
Do all schools want this? Do they understand the necessity of why this is so needed, Bianca?
That's a really good question as well. And I think you cannot know what you want unless you know what prevention is. So bringing the world of prevention into the school the language is going to be different. So bringing the language around prevention that's already known in the community into the school settings. Once you understand that, you definitely will know that it is needed. But yes, to answer your question, through our strategic planning, schools are implementing at a faster rate right now also SEL programs. Ever since the pandemic, they're starting to implement programs at a faster rate, and they're struggling with how to integrate that into all the multiple priorities that they're already working on. You know, they have federal and local mandates that they have to answer to. They have work around all the other efforts that they're doing. So supporting them in that system integration and integrating the programming into their schools is where we come in, is where we're able to help.
And Bianca, I understand CERC is sending out a survey to schools to understand, where the gaps are, what they need the most.
Yes, so we actually are sending out a survey. It's going out to all 169 districts on October 24th, I believe. And that survey is going to be important because it's going to collect information and data on the prevention programs that they're implementing, that Connecticut schools are implementing around mental health, suicide prevention, social emotional learning, and the impact of the programs, the priorities in prevention that schools have, so that we're capturing and creating a big picture of what our statewide efforts around prevention look like, so that CERC and the center and DMIS, we can then better assist the schools by knowing what that looks like. So that survey is going to inform the foundation for how we resource share, how we outreach in the future, and how we collaborate with districts.
You're hearing Bianca Arizari, a consultant with the State Education Resource Center, or CERC, coordinator of this new school-based Center for Prevention, Education, and Advocacy. Bianca, I wanted to play you a clip from a young person in our state, a senior health reporter and producer, Sujata Srinivasan. She covered a recent roundtable with U.S. Senator Chris Murphy, and there were kids from a middle school in Hartford. And this is what one student told the audience, the group, about people using drugs in her neighborhood.
My grandma calls them zombies. Like, they're in this world, and then they stop us from doing so much, because if we go out and they see us and they ask us for money, we're like, oh yeah, we don't have any money, they might get violent.
Could you respond to what we just heard? It's hard to hear when you hear children talking about what they fear, and that this is around them. We try to protect them, but there are still instances where they are scared and they need answers. And so, how would this school-based center help children like this?
Well, I think it will help the adults and the community, an environment that's having those conversations with the students. And how to approach the conversation, how old the student is important, the school that the student goes to is important in that conversation, the skills that the adult's having with that student is important in that conversation. So that's where we come in to support that skill building. Having conversations with youth about their fears and drugs and all of the things we're talking about today is hard, and it's not easy, and it's not a one blanket approach to how you will have that conversation with any one student. So that's why it's so important to get to know your students, to understand what environment, the attitudes, values, and beliefs the families have, the environment and the context where the student is living and attending school, so that you're armed to have those conversations, and not just educators, but the families and anyone that's part of that school system. And that's where we can help building those skills and supporting that and navigating those conversations.
And Bianca, we just have a couple of minutes left. I started this segment referencing that tragic story. Many of us remember that 13-year-old Hartford boy who died of an overdose in school. When that happened, there were a lot of conversations about having Narcan or naloxone in school nurses' offices. What resources can CERC provide for school districts who may be still weighing that decision?
Sure. So again, Narcan is one component of a really complicated approach to this epidemic. And so there are resources out there for you to CERC. The center is advocating for prevention, right? So that medical piece, that recovery piece is not where our entrance is going to be, but we do have collaborators under this DEMA stakeholder that can support with Narcan and training and having that in the school. We're promoting, although that is important, the preventative piece so that we don't have to have or use Narcan. You know?
Thank you, Bianca, for explaining that to us. Dita Bhargava is still with us. Dita, when we were having a conversation earlier, a caller called in, was unable to stay on the line. But I wanted to share this comment with you. The caller said there are recovery programs available 24/7. There are programs to help you get sober. It's not the program's fault. If you don't work, the program doesn't work. How do you address that? Because that is a sentiment that many people may feel.
Yeah, listen, it is never the fault of the person who suffers from a disease. And part of what Shatterproof that I'm helping with in the state of Connecticut is to bring a program called Atlas into our state, which would help families navigate the treatment centers and hold treatment centers to a higher standard of care and aid families in finding quality care, which we had many challenges with Alec. And there needs to be a standard of care, as there is for any other disease, as there is for any other hospital. This is very, very important. And all of this relates back to what we were talking about earlier, Lucy, which is stigma. Stigma needs to be erased, and that happens through education at every level.
Dita Bhargava, thank you again for coming on the show. A Connecticut resident and also ambassador to Shatterproof. We'll send out a link to our listeners on our website, ctpublic.org/wherewelive, if they want to learn more about Shatterproof. Thank you for coming on and telling us a little bit about your story.
Thank you.
Bianca Irizarry is also here, consultant with the State Education Resource Center, CERC, a coordinator of this new school-based Center for Prevention, Education, Advocacy. Thank you, Bianca, for your time as well.
Thank you so much for this great opportunity.
I'm Lucy Nalpathanchel. Today's show produced by Sujata Srinivasan. Special thanks to Katie Tolarski and Tess Terrible. We'll be back tomorrow.